We respectfully acknowledge that the Windsor Regional Hospital occupies the traditional, ancestral, and contemporary lands of the Nishnawbe, Ishkildwen, and Nishnabeg, the Three Fires Confederacy, Ojibwe, Odawa, and Potawatomi. We acknowledge the land and the surrounding waters for sustaining us, and we are committed to protecting and restoring these lands and waters from environmental degradation. Good evening, everyone, and welcome to the Thursday, December 5th, 2024 open board meeting of Windsor Regional Hospital. I'll call the meeting to order at 5:01, and I will ask if there are any declarations of conflict of interest. Okay, seeing none, I will move to item 3, the previous minutes that can be found on your agenda under tab A of November 7th, 2024. Assuming everyone's had an opportunity to read the minutes, can I please have someone move those minutes? Thank you, Anthony and Genevieve. Any questions, comments, amendments, modifications? Okay, seeing none, all in favor? That motion passes. Thank you very much. And Karen, I'll turn it over to you under tab B, the report of the acting president and CEO.
Thank you, Madam Chair. So good evening, everyone. So my report was in the package. I'm going to hit the highlights of that. So under our strategic direction of strengthening the processes that drive a culture of patient safety and quality care, our surgical safari tours resumed this month. So this is a fun, interactive preoperative tour for children that are ages 3 to 12 having surgery at Windsor Regional Hospital. And these are led by our child life specialists. So they provide age-appropriate explanations of what the child will see and do on the day of surgery. And children really benefit from this information, how it's presented. I apologize for my dog in the background here. We also are proceeding with the installation of our LINAC bunker. So that started the last week of October. And the machine itself is targeted to be up and running on December 9th. And then we'll continue on with our plans to replace our existing LINACs. Our new MRI is also up and running at the OLET campus, and we're in the planning phases to upgrade the other MRI at the OLET site. And our cath lab expansion project is well underway, and we're looking forward to having 2 cath lab tables available to serve our community and catchment area. We are entering our respiratory virus season, and from a provincial lens, we're seeing a percent positivity of COVID of about 11.4%, which is actually lower than the previous week. And our other virus positivity indicators are influenza 0.8%, RSV at 4.1%, enterorhinovirus at 10%. And so our current trends are running lower than last week for COVID and influenza, and RSV is slightly higher than last week. And so the trend compared to last year at this time is lower than this time last year. At Windsor Regional, over the last 2 months, we've been averaging about 10 to 18 cases of hospitalized COVID cases, which is lower than this time last year. 20 to 35 cases of other acute respiratory viruses, and the numbers of influenza and RSV remain low in the hospital. We had 1 of each case hospitalized in the past week, and a slight bump up with RSV this week to about 3 cases. So just to promote prevention for respiratory virus transmission, if you've not yet received your vaccinations for COVID, influenza, or RSV, we've got the link in the package, but you can go to ontario.ca. And they have a link there that you can click on to find out where you can get your COVID-19 vaccines or your influenza vaccines. And of course, always like to promote hand washing, staying at home if you have symptoms, coughing and sneezing into a tissue or your elbow if a tissue is not available, keeping your distance from people that are sick, keeping surfaces clean if someone is sick in your home, and wearing a mask if you're at increased risk from infection to protect yourself, or if you have to go out and you're sick to protect others. So we did update our masking requirements at Windsor Regional back in October to help prevent spread of respiratory illness to our patients, staff, and visitors. So we just ask that people check the signage in the clinical areas that they're visiting for any masking requirements. So those are the highlights from my report. I'm happy to take any questions.
Thank you, Karen. Any questions for Karen or comments from anyone? Okay, I do not see any. So thank you, Karen.
Thank you.
That leads us to item number 5, the Schulich report, and I don't believe Dr. Jacob could be with us this evening. So that moves us to tab C, item number 6, financial presentation. Anthony.
All right, wonderful. Matt, can you pull that up for me?
Sorry, just
Or I
one
can
second.
just talk about. No, that's okay. I can just talk about it if that's okay. Oh, thank you. So we can move. Perfect. Okay. So exciting news. We've received confirmation regarding our additional base funding of $12 million. And that's for a piece of the Bill 124 incremental costs. Friendly reminder, this does not cover all of the costs associated to Bill 124. There's still a shortfall, which the organization is strategizing on ways to come up with uh, those funds. So this funding is intended to support the eligible costs for our period October 1st through March 31st, which is our year end. And then the original allocation of that 13.2 million that was intended for the first half of the year. So overall, that total base funding that was included was $25.2 million. Moving next. So probably the biggest number on here, it's the net deficit after building amortization of $21.8 million. Unfortunately, that is about $6.1 million worse than budget. Again, so if you really think about it in terms of is that good or is that bad? That's about 1.5 days worth of operating costs. It may be 1 day. I have to double check my math. So we are very, very close to what we thought our budget was going to be. So the organization is doing everything they can do to limit that number. Again, the hospital margin is a negative 17.1 million dollars. And again, you're talking peanuts, but it's not peanuts, pardon me. But it's $6.5 million worse than planned. So we'll move on. Oh, got it. So if you take a look at the slide, we've tried to put a little more detail here. So essentially, benefits were a year-to-date difference of about $2.4 million. That's offset partially by CCPN funding of about 1.4 million. And that's for nursing bonuses, community commitment program for nurses. So we've increased the signing bonuses versus the prior year by $283,000. We had CPP of 222,000, fringes, hoop increased. Again, your wages go up, your hoop goes up, which is the pension plan for hospital employees. And then maternity top-ups were actually up by $153,000. So congratulations to all the families having children. Medical staff fees, we have a $2 million deficit, and that's with $1.2 million in additional med fees to earn about $1.2 million in patient service revenues. Additional deficits there of about $309,000 in the ICU. These are unfunded. And then $293,000 in funded emergency alternate funding agreement funds there. Let's see, what else did we have? We have medical surgical supplies, always a difficult one to judge. We're down about $1.4 million. Drugs is we'll call a $500,000 difference right now. pretty close to being dead on. So good work there. And then other supplies, always a difficult one to judge, but building equipment maintenance, legal fees, risk management, pathology, all of these items, any major, minor purchases, physician recruitment is also over budget. So again, we're doing what we can to limit that number, but unfortunately, we didn't budget as well as we wanted. So we're down 3.4 million. Overall, sick time, if you look, we are trending a little bit higher than last year or to target, pardon me. And this is a trend compared to the prior month. So overall, a little better, a little worse, but we're close. What I would say. Overtime obviously is better, which is good. So we're limiting that. And I think that is it for today. Did anybody have any questions with regards to any of the figures? I know it's a pretty comprehensive package, so going through it that quickly, you may have some.
Any questions for Anthony, anyone?
Or Heidi. She's here. Oh, I forgot to welcome Heidi. Heidi, thanks for being here. Melissa Gauthier is off today, so we have the vulnerable Heidi Zimmer here, who's the second in charge.
Thank you, Heidi, for joining us
Hello,
this
everyone.
evening.
Thank you.
Okay, Anthony, I do not see any questions or comments on your financial presentation this evening.
Perfect. Then I will move my report.
Okay, Anthony's moving. Would someone like to? Paul is seconding. Again, saying no questions or comments. All in favor? That report carries. Thank you, Anthony. If you want to keep going to the
Yeah.
consent agenda.
Yep. Can I move the consent agenda?
Okay, Anthony's moving the consent agenda of November 25th, 2024, and the operating results. Paul is also seconding that consent agenda report. Any questions, comments for Anthony or Heidi? Okay, seeing none, all in favor? Thank you, Anthony, that also carries. So thank you very much. I appreciate it. And Heidi, thank you.
Thank you.
That leads us to item number 8, which is correspondence and printed material, which can be found in your package under tab E, the media report. Again, that is for information purposes only. And I'll ask if there are any other questions, comments, or notices of motion from the board. Seeing none, our next meeting is on January 9th, 2025 in person in the auditorium. Look forward to seeing everyone. And I wish everyone a very, very happy holiday season and a healthy and prosperous 2025. When we come back on the 9th, it will be the new year. So wishing everyone a wonderful holiday. So with that, I will ask for an adjournment under item number 11. Thank you, Neela. A seconder. Mary, thank you. All in favor? That motion carries, and we will adjourn at 5:14. There is no media report tonight or media scrum tonight, so we will sign off on this one and jump right back on for the in-camera meeting. So thank you, everyone, and happy holidays to everyone who has joined us this evening.